UPMC Rehabilitation Institute is home to the largest network of rehab services in southwestern Pennsylvania. With 90-plus inpatient, outpatient, and long-term care centers, teams meet patients' needs at each phase of recovery. Specialty occupational therapy can be found at nearly 30 of these outpatient locations, offering expert care close to home and work. Hi, I'm Charlie Batch. Joining me today is Maria Scolieri, occupational therapist at UPMC Rehabilitation Institute. Thank you for joining us today.
My pleasure. Thank you for having me.
Now let's start in general. What does the occupational therapist do?
Our main focus is to help increase your function and to increase your ability to do what you need and want to do during the day.
Now, who can actually benefit from seeing an occupational therapist?
Almost anyone. I mean, someone who has, say, arthritis, and it's someone that has had an injury, anyone that's had some sort of neurological issue, whether it's a stroke or Parkinson's. The main goal is to try and increase their independence.
Now, can you talk about some of the specialties that are in the field of occupational therapy?
We treat anyone from pediatrics all the way to geriatrics. There's therapists that specialize in neuro and low vision, helping people age in place at home as well. Industrial rehabilitation. Myself, I specialize in hand therapy after anyone has an injury from hand to upper extremity. So if I'm working with someone in hand therapy, we may be working on increasing their range of motion so that they can close their hand better to grasp that hairbrush so that they can dry their hair and wash their hair in the morning. We may be working on strength to improve their strength as well in order to complete some of their daily activities, working on decreasing pain, edema, and swelling as well. We can start adaptive equipment if it's needed. There's different jar openers out there, devices to help them turn keys, different built-up utensils to make it easier for people to grab onto things. All these things that ultimately will help them to be able to better function during the day and to do what they want to do.
And what is the most rewarding part of your job?
Just seeing someone come in and they're not able to move their hand very well, or it's very painful. And then when they come in as we're working and they tell me, you know what, I was able to use this hand to help me. So going through the process and knowing that we've helped them come along to be able to achieve those goals for themselves.
Maria, thank you for joining us today and sharing all of this important information.
My pleasure. Thank you, Charlie.
To learn more about occupational therapy at UPMC Rehabilitation Institute, visit upmc.com/outpatient rehab.